Now, biological dentistry, we'll start there. What does that mean? What does that mean, Ed?
I think it's simply saying that we are understanding and connecting what's going on in the mouth with the rest of the body. Understanding that there's a biological process that happens, but staying rooted in science. So as your health practitioner, I'm prepared to stay current and follow science and move with science, but always stay within what has been published and researched.
Now, for people just tuning in, you do traditional, what we would call traditional dentistry. You do dental implants, placing and restoring dental implants. You do fillings.
I offer everything that a regular dentist offers. I offer all the materials. I offer the same freezing, everything that all the same pharmaceuticals, everything that a dentist offers. But on top of that, I like to think that I offer choice and education.
Now, when we invite you on the show, this is a hot topic. We get a lot of emails, people concerned about root canals, fillings, things like that. Do you hear that a lot? Is it more awareness of saying, boy, I got metal fillings, I got to get them out of my mouth?
I think that as a population, we're becoming more aware in North America. I still think that there's room for that to grow. But of course, people come in all the time, and whether they realize it or not, these are questions that they have to ask. And I consider these controversies in dentistry. I don't think we've reached an end stage to know that root canals are 100% unhealthy or healthy. I think that you need to look at the overall situation.
So are patients coming in and asking for this kind of dentistry? Is it called holistic dentistry?
It's similar to holistic dentistry.
What do they call it, though? What do the patients say? Metal-free dentistry?
Oftentimes patients, they don't really know what they're looking for, but they're looking for minimal toxicity and prevention. They're looking for ways to increase their overall health.
But can you get the same results, though?
Absolutely. I will never compromise long-term functionality and long-term success of dentistry for holistic practices. I actually will combat that with saying that I think I get better results. Patients that respond well to homeopathy, patients that don't use pharmaceuticals and pain medication, antibiotics for their procedures, heal better and heal faster.
So after dental school, extensive training in homeopathy, what is homeopathy?
Homeopathy is a really interesting modality of medicine. I've been studying with Dr. Andre Sain, who's one of the foremost homeopaths in the world. And basically, what homeopathy does is it takes a holistic approach to health and says that you have to get your hygiene or your lifestyle up to proper balance before you can even intervene with therapeutics. It recognizes that far more so than just pharmaceuticals, we also need to live well. And that's having a balanced diet, having balanced sleeping schedules, exercising well, stress relief, adequate sun, which I know in San Diego you don't have a problem with, but in Toronto we definitely struggle with getting enough sun. And it's making sure that all of those parameters in our life are balanced.
Now, is this fair to say, though, that you say, because we talked on the phone, that pH balance, gum disease, rampant decay are all signs of poor homeostasis, is what you said. And so elaborate on that.
Yeah, I think so, because oftentimes people come in and they say, why am I getting cavities? And they're brushing their teeth, they're even maybe flossing their teeth, but they're still having...
Isn't it just from not brushing?
Well, I think that there's a greater picture involved. And and each of those things is almost its own story, but take pH, for example. pH is the balance in your body, how acidic you are versus how alkaline or basic you are. And if your body is too acidic, then your saliva isn't buffering bacteria and you're going to have more decay. You're going to have more cavities.
Interesting. So people with great teeth, do you find that they have higher alkaline?
I would say that people that have great teeth and have great gums often have a very balanced pH or slightly alkaline pH.
People like with periodontal disease, like bleeding gums, bad breath.
So with those type of patients, they always come in and say, why? And it's easy. It's really hard in this short.
They say why what though? So I'm clear on this.
Why do I have bad breath? Why am I losing my teeth? Why do I have gum disease? I brush my teeth every day. What's going on?
Yeah.
And it's very difficult in this short period of time to go through that comprehensive answer and the full investigation as to why. But it's all about tools and knowledge. And so I don't think that there's ever any one patient that comes into the office in one day and will have a complete printout where they can say, if you do this, 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 and this, then your gum disease will completely go away.
But you could turn that around, though.
Absolutely. And we go through an investigation of how are they living, how are they eating, and we also get specific in terms of what bugs are bothering them. And I always say to my patients like this, I don't mind the type of treatment you choose to get rid of the bugs. The fact of the matter is that we have a diagnostic tool, we can see what bugs are there, then we can decide on treatment. If you want a pharmaceutical approach, great. If you want an herbal approach, great, or a homeopathic approach.
So you kill those bugs?
But we kill the bugs and then we take a follow-up slide to make sure they're gone. Now, what I've been learning through experience is that only targeting the mouth, we sometimes aren't able to get rid of all the bugs. So for example, if you have parasites in the mouth, I can give you some great herbals for the parasites or some pharmaceuticals for the parasites. But unless you take a look and get to the source as to why are these parasites there, what's going on in the body, then you'll never completely eradicate the parasites.
It is unusual to hear from a dentist saying you should, about sleep and stress and these kind of things.
Well, it all plays a role. And if you think about it in terms of nutrition, you are what you eat. And we're so often neglectful in terms of how we eat, putting too many stimulants in our body, eating too acidic of a diet, all the refined sugars, all the processed foods. Unfortunately, we live in North America where
do they want to hear this, though? They go to the dentist, they just want you to fix their problem?
Well,
I mean, what is the response from patients?
I think that
they like this?
Patients love it because it's giving them a why instead of just fixing problems. And I find that, patients want their fillings fixed, they want implants placed, and I do all that. We do all that as an office, and it's important. But I'd like to minimize the type of trauma that a patient undergoes, and especially with children. It's really great, instead of just fixing their decay, taking a look at how much pop are they drinking? Why are they getting so many cavities?
So you're asking the why, because is your hunch that there's not enough of that going on with other dentists? I mean, somebody has a bunch of cavities. I have kids. So you're saying why? Why are they getting cavities? I mean, is that what goes on in your head?
Absolutely. And as a human being, we should not be as susceptible to decay. We should not be as susceptible to gum disease. And it's about building up a child's nutrition, making sure they're not as susceptible to decay. Because you also have to think about it. If a child has tooth decay, that's something that we can see. But what else is going on in their body where they're not as well? Maybe we're not seeing those symptoms as quickly.
Very interesting. We're going to take a quick break. Back to more about biological dentistry. You are watching The Wellness Hour, the leader in medical news and information. We'll be right back. You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, biological dentistry. We're here with Dr. Schecter, Michael Schecter, and we're discussing in the last segment a little bit about gum disease. I mean, you look at it differently.
Yeah, I think I can really explain everything with a case, because people are individuals, and it's really easy when you take a look at a previous patient and see how the journey they went through. So he came in to see me, and very friendly man in his 50s, great guy, and he was worried because his two front teeth were very, very loose. When I took a look in his mouth, they were so loose that they could have come out just in my hand. And as a dentist, my first instinct is to say, I got to get those teeth out, I have to restore the area, I want him to look aesthetically proper, be comfortable, he's a musician.
That was your training in dental school?
Absolutely. And it's still obviously a part of the treatment plan that I was putting together for him. But what I also
saw... So this was past save those teeth?
100%. Okay. They were hanging by a thread. And what I also realized was that his gums were almost blue. And he hasn't been to a dentist in a few years, and I got the feeling that his health wasn't 100% there. So we took our normal information, collected some information, we took his blood pressure. His blood pressure was 180 over 100. Your normal blood pressure should be 120 over 80. 180 over 100 is already in the area where I'm concerned about working on him without doing some due diligence and speaking to his doctor.
Okay.
So I went through the conversation with him, explained to him what was going on, and he became very interested in my approach and didn't want to segmentalize his problems into gum disease, tooth loss, high blood pressure, and these other areas, but wanted me to help him work on improving his lifestyle, balancing his lifestyle, and using non-toxic therapeutics to help treat him. So homeopathy is always my #1 choice. It's non-invasive, non-toxic, no side effects.
These are herbs?
It's not herbs, actually. It's potent-sized remedies on glucose pellets. Okay? And I'll go into it in a second.
All right, okay.
But what you do is you take a case of a patient, and you take his overall picture, find out really what's going on, and try to match that to a remedy. So we took his case. After collecting all of the proper information, I knew specifically what bugs he had under his gums, I knew exactly how much bone he had, we took necessary x-rays, all of the regular information collecting that a dentist will do. We then took a case, and his remedy picture just screamed out at me. Okay, he's Natmure, which is table salt. Okay. He took the remedy, and that night in his bed, the tooth came out onto his pillow. Okay, he called me in the morning.
But that doesn't sound good. I mean, was that the goal?
It doesn't sound good, but that tooth needed to come out. That tooth needed to come out, and I was concerned to take it out because of his other health issues. And it was almost like the body was triggered to heal and was removing that infection.
Interesting.
The tooth came out. Within a week, his blood pressure had regulated to 125/95. His blood sugar came down from a 12 to a 6.
Just because his tooth comes out?
Everything.
Infection goes away?
It's not because his tooth came out. That was another side effect of the remedy doing its work. What we saw overall was a movement towards health. His gums became pinker. The bacteria, the fungus, the parasites that we saw under his gums started to disappear.
With things that kill those bugs. It was like a combination therapy?
With the remedy that he was taking, along with some hygiene that we were doing. Like I talked about earlier with homeopathy, it's about getting hygiene up to par, and then also using the remedies as the therapeutic response. So now the beauty of this is he came in to see me looking for a solution to one tooth, and he left with feeling better overall.
Backing up.